So let's talk about expressing that breast milk. There are a couple of different ways we can do it. You can do it with your hand, you can do it with electric pumps, you can do it with hand pumps. But there are some reasons that you want to know how to express milk. You could use that colostrum at the beginning to kind of entice the baby to latch. So you need to know how to get that colostrum out. You might be applying that to the nipples if they're sore. When you go back to work, if you have to go back to work, you're going to need to pump milk if you want to continue breastfeeding. Sometimes your baby is in the hospital. Premature, they're born premature. They're going to need you pumping for them because they're not quite able to suck at the breast yet. But your breast milk is really important, so we definitely want you doing that. Sometimes moms get sick, and we had a mom just last week who had to go into the hospital. She had an infection that occurred after the delivery, so she needed to pump while she was here. It can also increase your supply. So if you are having any need for a pump, you can call us. We'll be glad to go over all of this stuff again. So hand expression is a technique that I really want you to learn. A lot of times moms will just go and kind of try to squeeze like this to get a drop out, and they're like, nothing's there. Remember from that earlier segment where the ducts are all up in here and the milk's being made back here, okay? First of all, anytime you're putting your hands on your breast to get milk or pumping, you want to wash your hands, okay? And then you can massage the breast, which will kind of prepare it for getting that milk out. So what you're going to do is actually hold your hand like you're holding a cup and put that around the breast so that the nipple is lined up between the thumb and the finger. And then what you're going to do, remember we're not up here, we're back farther. So there's a good inch between the nipple and the fingers. Go straight in toward the chest. So you're really going in, okay? I'm not moving any part of the fingers. Straight back. So straight back into the chest. And then you're going to compress your thumb and finger. So back here, and just hold it for a second. The first time that you do this, it might not get anything, okay? Colostrum is really thick. It's the consistency of honey. So to get that out, and you're just kind of compressing, it's going to take a little bit. And then you'll start seeing some little beads of colostrum. Keep doing that, and you'll be able to get more, okay? Some women are really efficient at this, and they're able to do it better than even using a regular electric pump, okay? So now we've gone over how to hand express, but there are different mechanical ways we can get the breast milk out also. It goes a whole bunch of different sizes, styles, all that kind of stuff. It depends on what you are pumping for, okay? If you are pumping just out of the blue, you just want to get a little bit of pressure off your breast, these hand pumps are great. They're fine. They work fine. They have like 2 different little modes where you can actually do fast pumping and slower pumping to kind of mimic the baby. Obviously, this is not battery. You don't need a battery. You can take it with you. It can only do 1 breast at a time, so there are some limitations there. Then you go up a little step farther, and of course, expense-wise, you're going from the low end to the higher end, going this direction, okay? So a little bit more, you've got, does have a battery packs, but it also can be charged, electrical outlet. It has a nice little clip on the back, so you can kind of clip it on your body. But again, this has just 1, so you can only do 1 breast at a time. Then we've got a double electric pump, and in the Affordable Care Act, it is covering a breast pump for moms. Okay, so if you have a desire to pump at all, call your insurance company, let them know you're having a baby, and see what they need you to do to get that pump. A lot of times all you have to do is go through your doctor. They have to send in a prescription, fax it into your insurance company. But usually what they've been giving out, from what I've seen, are double electric pumps, which plug in They do both breasts at the same time. They've got a speed control and a suction control. They're all different brands. We've got Amida, we've got Medela, Lancino. It's what you are comfortable with, okay? You'll notice some of the flanges are softer, some of them are round. I know some have more oval kind of shapes, so it's really what you're comfortable. Okay, so let's talk about this hospital grade pump. This is able to get a full milk supply even if you're separated from the baby. So in the hospital, if your baby goes into the special care nursery or NICU, we're going to get you started using this in the hospital so that we can get that full milk supply established. It is Symphony, and it is able to be rented. It's really too expensive to buy. It's like thousands of dollars, so you can rent them. Over at Mary Washington's Pharmacy, they have a rental program. It is able to do both breasts at the same time. It has a suction control here, and that is for your comfort. So earlier we were talking about some of the problems with the nipples being sore might be because of the flange size, okay, or the suction. If you've got the suction going too strong, you're going to have sore nipples too. So you want to see the nipple going in and out of this canal. You don't want to see it getting sucked in, okay? These come in different sizes. If it's getting sucked in, you need to go to a smaller flange. If it's getting pushed up against the side like that, that's going to hurt. So we don't want you to keep doing that. You need a bigger size flange. Lactation consultants will happily help you to get that right size. But it really doesn't depend on the size of the breast. It depends more on the elasticity of the breast and the width of the nipple, okay? So it can change during your breastfeeding experience. In the beginning, it might need to have one size and then have another size later. Okay, so when you are pumping, you are going to, if you're using an electric pump, you're going to want to pump both breasts for 15 minutes each time, and then just turn it off, okay? You don't keep pumping for an hour. I had a mom call me the other day, and she said she's pumping for 35 minutes and not getting anything. I'm like, first of all, that sounds painful to me, but you don't need to do more. That's not going to help right now, okay? So 15 minutes, you do both breasts at the same time, you turn it off. There are some websites. Stafford School of Medicine has great websites where you can see videos of pump use, hands-on pumping, which are other ways to get more milk. Okay, so using a pump, any one of these pumps, it's very important that you clean them after each use, okay? Warm soapy water, rinse them, let them air dry. That's what we do in the hospital. When you're home, same thing. You can use dishwashing soap, Castile soap, it doesn't really matter what soap you're using, but you want to do that good scrubbing and let it air dry. You also will once a day want to sterilize these, okay? So you can do the old-fashioned way, just boiling in a pot, okay? You can use the dishwasher. So you just need a kind of mesh thing to hold the pieces so you don't lose them, but the dishwasher will sterilize it. And then they also have bags that are able to be used for like 21 days. You get them, it'll tell you how much water to put in it. You put it in the microwave, so you can use that. But definitely sterilizing once a day is recommended by the Center for Disease Control. Okay, so how do we store the milk? Breast milk is pretty sturdy, actually. So when you're in the hospital, it's good at room temperature for 4 hours. So if you're pumping and your baby's in the nursery, we're going to have you pump, and you can leave that milk just on the counter and then take it down when you go to the nursery. If it's only a half hour or so later, that's fine. So there's a slide that I'm going to show you that has just different times ranges. Now, this is actually just one. You're going to see lots of ranges for this, okay? But for us, we say 4 hours at room temperature, 4 days in the refrigerator, and 6 to 12 months in a freezer. Okay, so again, this is all for full-term babies. The American Academy of Pediatrics has recommendations that are very similar. Everything's kind of in a range, but just these are guidelines. Okay, what do you do when you've got frozen breast milk? Now you want to give it to the baby. Okay, so there are different ways. You can thaw it in the refrigerator. You don't want to leave it out on the counter to defrost. You can take a cup of warm water and just put that down in there. What you don't want to do is you don't want to shake it. You don't ever want to microwave it. Okay, microwaving really gets hot spots, and it also can break down the proteins. Okay, so just putting it in the bottle in a cup of warm water, and then just swirling it. Okay, is all you'll need to do. You don't ever want to combine old milk with a new batch. Okay, you want to not refreeze milk that you've thawed, okay, things like that. And you really don't want to ever just really shake it, like you'll see people starting getting their formula together and they're shaking these bottles. Don't do that with breast milk, because you'll break down some of the proteins and the little organisms that are in there that are good stuff. Okay, so there are more than there are quite a few ways for you to actually give this milk to your baby, okay? Of course, there's the bottle, which everybody thinks that's the only way you can feed a baby. But there are lots of options, and if we're dealing with a baby who's having trouble getting to the breast, we're going to use some of these options. So I'm just going to show you them. We can use a spoon. You can, remember that hand expression? You can get that on the spoon, and we can feed the baby, okay? This is for a larger amount of milk, same type concept. It's called a Foley cup. And you'll get the milk right up in this little lip there. You'll put it at the baby's lip, and they actually kind of lap it like a little kitty, okay? So that's another way to get it. If you are pumping, we will take the syringe and we'll kind of just pull up the colostrum, and then you can actually put that in the side of the baby's mouth while they're either on the breast or finger in their mouth sucking or a pacifier, and you can just gently push it. Sometimes if they're sucking strong enough, they'll pull it in themselves. And then if we're really wanting to get the baby to go to the breast more, and we're trying to give a supplement at the same time, we can use tubes like this, and we'll actually put it right at the breast so that it's here. And then attached to this could be a syringe that has some of the breast milk in it. And it's similar to this. Okay, so as the baby sucks, they can pull that in, or we can gently push it in. So there are lots of ways that you can give that. If you choose to give the bottle, there is a specific way that you can feed using a bottle where they're not getting it so rapidly, and holding it more horizontal like this. So you hold it here, baby's here, and you're going to let them do the work to get that milk, okay? If you do it this way, it just kind of drips in their mouth, and that can help them think that, oh, this is easy. I don't have to do very much. So they're not going to want to try it at the breast as long. What about going to work? Moms worry from the day that baby's born that they got to get milk stored. You hear stories online. I've got a freezer full of milk. Okay, what is that milk doing? It's not necessary. You don't have to have this huge amount of ounces of milk. What you want is enough for when you go back to work that day or two, the first couple days. So if you start like 2 or 3 weeks before you go back to work, pump once a day. Usually in the morning you have more milk than the rest of the day, so let the baby feed and then pump and then store that. The next day, do the same thing. Keep doing that. By the time you get ready to go to work, you're going to have enough supply to get through those first couple days. And then, of course, when you're at work, you're going to need a pump with you. I would definitely recommend at least a double electric pump to take to work with you. It is more efficient, okay? It's going to work better for you, less time. Have something where you can store it in a refrigerator, and a transport kind of container. You want a thermos of some type where you can put cold packs in there to transport it home. And then how are you going to find some breastfeeding support? We're here for you, okay? You're going to find support from friends, peers, anybody who's breastfed before. You can talk with your pediatrician. Definitely call us. The WIC, if you have qualified for a WIC program, they have peer counselors that will help you with breastfeeding. We've got evidence-based websites that you can go to. We'll have that in our bibliography at the end and references. We've got support groups. So right now, we have 3 different support groups going on. One of them is virtual at the moment, and then we're going to get back to be actually in person. But at Stafford Hospital, we do them on Tuesdays from 10 to 12. We have once a month, we will do a Sunday afternoon, and we've got Mary Washington does theirs on Wednesdays. So those are open. You don't even have to have delivered here to come to these support groups, but that's really a good support. And then if you're having any questions, we want you to call us, okay? This is a lot of information. You go through back all the different little segments and really get the class, but we give a 2.5-hour class once a month, one at Stafford Hospital, one at Mary Washington, so you can be here, hands-on. We can help you with different positions and things like that seem to be helpful. And so feel free to please call us and join in those classes. Mary Washington has an outpatient clinic that they can see patients that are having problems with these feedings. You've gone home from the hospital, you still need some help. So you can make an appointment with a lactation consultant and go in and see. They'll watch a feeding, we'll weigh the baby before and after. So definitely there to help you with that. So if you have any questions at all, you can call our HealthLink number. That is 365 days a year, 6 a.m. to midnight, and just call with questions. If you're having a specific breastfeeding question, they'll hook you up with us. They'll get if they are able to answer those questions. Have a good, safe delivery. We hope that your breastfeeding experience goes well, and we're here to help you.